Hello, my name is Pamela Gibson. The article I wish to discuss comes from the Permanente journal and is entitled, How Asking Patients a Simple Question Enhances Care at the Bedside. Medical Students as Agents of Quality Improvement. This article is composed by 5 third-year medical students and was written in 2013. I selected this reading based on the work being done at the Institute for Healthcare Improvement Open School, because it is an interdisciplinary community that has a mission to advance healthcare improvement for the next generation of healthcare workers. The purpose of this article is to identify opportunities for medical students to make active contributions to healthcare delivery and its improvement. Patients all too often feel ignored and report that their healthcare has been fragmented and not holistic. The quality of patient care has raised considerable political and public concern in the UK, fueling efforts to achieve a patient-centered culture within the National Health Service. The researchers at the Institute for Healthcare Improvement, through the Open School chapter at the School of Medicine at Cardiff University in Wales, United Kingdom, sought to adapt and develop the Ask One Question concept. The researchers felt that the medical students were an untapped resource who traditionally played a passive role as observer. The students also had more flexibility and time and needed to be trained to speak with patients directly as our future caregivers. Having a specific question to ask allowed medical students to engage directly with patients, helping to improve their patient communication and empathetic skills. The method of the study had the medical students collecting data in 4 different cycles. This all began with the question, "What can I do to improve your stay?" being asked at different times during their encounters with patients, leading the students to discover that a trusting rapport was important. And once that had been established, then the patients felt comfortable discussing their medical needs with the students. The survey involved in this study included 120 patients being questioned over a 2-month period. 72 of these patients were male, leaving a total of 48 being female. The results of this study were categorized in 4 broad areas of ways patients asked for improvement. The first were communication issues, such as more time with the healthcare professional. The second were practical issues, such as requests for items. The third were wider organizational and NHS requests, such as issues with noise. The fourth were medical needs, such as requests for medical assistance. The Ask One question can be a vehicle for identifying existing excellence in care, as well as for identifying opportunities to improve care. Contributions in patient care can be made by participating students who found that patients feel more comfortable dialoguing after history taking or physical examination. The feedback provided by the medical students has been used in conjunction with patient satisfaction surveys. This study had a very short time frame and didn't involve very many patients. I would like to see an expansion of this study involving other students, such as nursing students, and see what perspective they could add. However, it still showed how medical students bring a fresh perspective to the aspect of patient care. The Ask One question is a vehicle for improvements, an opportunity for educators, and has the potential to encourage rapport with patients. The questions I would like to leave you with are, what can Ask One question mean to you as a healthcare manager? How can Ask One question benefit other healthcare employees? How else can medical students have positive interaction with patients? Would you implement an Ask One question at your healthcare facility? And what would be the pros and cons of applying this question?
I would like to leave you with the following quote from Donald Berwick, MD. I think healthcare is more about love than about most other things. If there isn't at the core of these two human beings who have agreed to be in a relationship where one is trying to help relieve the suffering of another, which is love, you can't get to the right answer here. Thank you.